When you mentioned burnout, have you had that moment where you felt burnt out? And what does burnout look like in a space where, you're speaking to patients? Is it just the workload? Is it just the things that you hear? Like, where does burnout even come from?
Mhm.
Especially where you say, "No, I'm happy." I don't even know if it's happening, but just want to kind of, for
Yeah.
those that may want to do the same thing.
Yeah. Well, the beauty of this is that it's not happening in this job. And that is 100% why I left the last place I
Hmm.
was working. Because in that place, it was happening. And so that's where, it would just be patient after patient after patient after patient and trying to see, certain numbers and at the end of the day and not feeling like I was pulled in 17 different directions and not feeling like anybody was getting like the best of me. And so, to me, that's a time when mistakes are made and when things are missed and when I'm not, that patient deserves your full attention when they come in. And if you're busy and rushed and thinking about 17 other things, they're not getting that. And so that's what I'm loving about this is that I haven't felt burned out once. And so the
That's so
beauty of
good.
this is that because I am getting more time with each person, and we don't necessarily need an hour for each visit, but at least they know they have that, and I know that we have that. So there's no rush, right? We're able to kind of talk. If they want to talk for 5 minutes, great. If they want to talk for 15 about one thing, fine. We have that, and so we can kind of really take our time. And I think that's what you don't get in a normal
Hmm.
kind of primary care setting is time.
Yeah. When I have my coaching, I do coaching and consulting. So with the clients, like you mentioned, maybe they don't need the full hour, but knowing that they have that time slot that is
Mhm.
completely theirs, acts
Mhm.
away, like, take your time, no need to rush, truly does make a difference,
Mhm.
for us, the ones that are providing the service,
Mhm.
but also the ones that are receiving that service. It just makes things a little bit easier. As you mentioned, the anxiety becomes a little less because
Mhm.
they know they're not going to be rushed out of a room
Yeah.
without having all their questions, right?
Mhm.
Sometimes that causes us to not think correctly,
Mhm.
right?
Right.
So
Right.
you're in a better place
Right.
now, right? Just
Right.
relax. You go in there,
Yes.
you create your own
Love that. Mhm.
schedule.
Yeah.
I love that. I love that for you, and I love that you're
Yes.
growing and you're not feeling the burnout, and that
Right.
you've now added, not feeling a burnout, and then you still added someone that's just like
Mhm.
you're living the dream at this point,
Mhm.
right? It
Mhm.
is a
Yes. Yeah.
so I almost feel bad for the coworker that didn't jump on
I
board.
know. I
Did
know.
you still do you still have the conversation?
Oh yeah, all the time. I know. I know.
Yeah.
Yes, all the
Oh my
time.
gosh.
All the time I see her. Yeah.
What
Maybe
is she
she'll
saying to
still
you?
well, maybe she'll still join me. I told her that I was gonna go make some money and be able to pay her. And then
All right,
yeah,
there we
yeah. I
go.
think, it was a little hard to bite off that I'm gonna come work with you, but I'm gonna make $0 for a little while.
Yeah, yeah.
When you
That's
start
that's
a
what
business,
happens.
it's a rough, for a working mother with kids to feed. That's a rough
Yeah,
pill to swallow. And so,
it is, and it's just not for everybody.
no,
It's just not for everybody,
no.
and some people would love to work for that private,
Mhm.
doctor or practice, and people love those privates, but they will never do it themselves, just
Right,
because it is
right,
very, very hard.
right,
It is. You have to be strong-minded. You have
right.
to, I mean, have faith that
Mhm,
it's all going to work out
mhm,
through those dark times. I can imagine that you probably faced some of those times where you had imposter syndrome. What the hell am I doing? Am I
mhm,
doing the right thing?
mhm.
But you pushed through, so congratulations. What does it mean to lead with heart when the whole system is actually built to break it?
I know. Well, and I think that's really where you don't have time to do that in another kind of setting because in a traditional setting, you're leading by what the the insurance company says we're doing. You're leading by, hey, this person comes in with high blood pressure. Well, we need to do X, 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 and X. And on this side, it's like, okay, but let's look at that as a person and figure out why their blood pressure is high. Are there things we can do to reduce that before we just throw medication at it? Because throwing medication at it is the easy. That's only going to take you 5 minutes at that
Yeah.
appointment, right? But asking about are they stressed? Are they exercising? Are they sleeping well? Do they have sleep
Mhm.
apnea that's not been diagnosed? Like where are some of these other areas that we could with more time invest in and even just small tweaks to whatever it is that their lifestyle is, can we fix something else or work on something else I mean, yeah, sure. Sometimes we just need meds for things. Blood pressure, sometimes the only way to bring that down is with meds. Fine.
Hmm.
But to really make sure that we've maximized all of that other stuff and to put like heart into that takes that time. And so I think that's really where it's just a very different way of kind of looking at healthcare and the human body.